Okay, so I am going to get my Easy Gel today. If they can get my blood draw. Always, you never know. This girl's a rock star. She always gets it. But Easy Gel, the guys hate this part because we got to get our blood drawn and the alcohol's going on. But if you think about it, it's way easier to get a blood draw than have fat harvested. That's a lot worse, I think. Do you think? Because and you say that because things don't hurt down here in your belly. You get your belly fat taken out. Fat has a lot of stem cells. Now, the problem with taking the fat is, let's say I want a little more result, or let's say the fat doesn't all take. You have to go and get another blood draw or a fat harvest. In this case, I'll get another blood draw. I'd much rather get a blood draw than a fat harvest. The other thing, if you're taking stem cells from fat, is that you then have to reharvest, and you're going to have a kind of a deficit or a void from where you take it, which you might say, okay, you're getting fat taken out, that's a good thing. But it's kind of interesting when you see people who get fat taken out and there's a little void in the body or where they take it out from, people often don't like it. So blood draw is the easiest way to get our stem cells. And we've proven in platelet-rich fibrin spins, there's 2% mesenchymal stem cells. And that's what we're trying to get, is mesenchymal stem cells. And 2%. Now, what is in fat? About 10%. Bone marrow also has stem cells, as does umbilical stem cells. So this is probably the easiest way. Am I having any blood there?
You got oodles.
Oodles of blood. I had 1 glass of water today. And the reason is these girls don't let me drink here in clinic. They're rolling their eyes. Is it true, Jamie?
It's not true.
Not true. But I honestly should have drank a lot more, but I didn't know that I was going to get this treatment today. Jamie's going to do my injections, and we're going to do under eyes for sure. And what else are you recommending for me?
Anterior jawline.
Now they're going to filler in the jawline already. And then what else for the Easy Gel? Do you think I should get lateral cheek, front of the cheek, nasolabial folds? I can't tell. I need these guys to tell me what to do.
Under eye.
Maybe we should hear from our viewers first what I should get.
Yeah.
However, since this isn't live, I'm not going to let you participate. But I would love to hear what the viewers think I should get in the comments below.
Yes.
Feel free. You're not going to hurt my feelings. This is what we do. So what, Jamie, you're assessing me. You're right there. What should I do?
Definitely under eyes today.
Okay, under eyes, definitely. When the projector says definitely under eyes, that means they're bad. Okay, next.
High cheek for sure.
High cheek, so they always want to feminize me here. I struggle to stay male here because they want me to do lip filler, they want me to do this, but we are fighting this. But I'll do a little high cheek.
Yep, and then anterior jawline with some define to give you a little bit of a pop.
Anterior jawline, and when I first got in the chair, they kind of recommended to go straight to the facelift. So I am getting away easy now. Okay, so that's what we're going to do today. So once we get the blood draw, we're going to spin it down. We'll take you through the spin a little bit, and then we'll show you the injections. Under eye, high cheek, maybe a little in the front, chin and jawline, and we'll show you that whole treatment. I hope you enjoy. Okay, so she drew my blood. We're now spinning the 2300 RPM, and that's going to be for a total of 7 minutes. We have our 2 PRF. This is the ones we're going to harvest the stem cells, mesenchymal stem cells, cytokines from in here. And these are the complete kits that come in. So what we're going to then do is draw it up in syringes, and we're going to heat the albumin component. Okay, so I want to show you a little bit about the syringes that you get because they're color coded, and we'll take you through that. One's for albumin, the heating. The blue one is for our PRF liquid, and then the red ones are really cool because that's what we use to inject. But that's our initial spin. So fast spin, we're going to heat the albumin, we cool, and then slow spin for the PRF and stem cells, and then we're going to mix them back. And then the fun part, we're going to inject it. It's full of chylomicrons.
Wow, they did take your blood.
Yeah, that's from the pizza today, the high cholesterol right there, and the pizza's going right back into my face. So Jamie's going to pull that out into a 5 ml syringe.
Should we get closer here?
Oh, they don't want to see me closer.
Or? No, Jamie.
And the reason we're doing, and you can ask if they have questions, but the reason we're doing 1105, I find when the blood is cold, you just have to spin a little longer, a little faster. So that's what we're doing. And then we're going to take the albumin and we're putting it actually in a 5 cc heat resistant syringe today. And we're going to put it in, let's see how much we get here.
PRP or PRF?
We never use PRP. That's like a bad word around here. PRP means failure. I say PRP equals failure. Platelet-rich fibrin, slow spin speed, no additives. I just had a blood draw. I want the maximum growth factors and stem cells. It's PRF, platelet-rich fibrin. It's a great question. No additives, slow spin speed.
Injecting this guy.
Yes.
I am the most high maintenance. What's your phone number? What's your home phone number, by the way? I got to call you. I got to call you tonight at 2 a.m. with my. Can I take an ibuprofen for pain?
Yes, you can.
Oh, already answered it. And then let's see what we get. We usually get about 4 cc's of albumin at the fast spin speed. And then we're going to take that albumin, heat it, and she's already spinning the platelet-rich fibrin. Jamie's fast. Jamie is fast. Like you look around already, it's already made up. And then the hard part, then they're going to inject it into my face. But I'm excited because platelet-rich fibrin, growth factors and stem cells, and particularly vascular endothelial growth factor and of course fibroblast growth factor back into the face. So
What is Easy Gel versus PRF then?
Easy Gel is when you heat the albumin component. And if you study albumin, the proteins unfold and they volumize. And there are studies putting just albumin in the face and having it last 3 months or longer. But why we're using it is to hold the growth factors from the PRF in the face longer so that they can actually work. One of the problems with PRP, blood thinners, boom, you get a rush of growth factors and stem cells. We don't want that. We want a slow release because that's what it takes for good skin.
Got 3 of albumin here.
3 of albumin,
Check
not
that out. Bring
bad.
it closer.
And what do we have, a 3 ml syringe out of the kit? Okay, so we're going to put
And that's
that
Dr. Rajani's.
albumin, yeah. Hopefully it's mine. If not, I'm getting someone else's.
Yours.
I want, is there 20-year-old albumin around here? Like you can just use PRF gel alone in the neck and neck bands, or you can add radius to it. And there's a formula on the training website. I do that actually there. But you got to add a little bit of lidocaine because it gets kind of thick.
And remind us what you're going to be doing today. Or what
Well, I don't know what my injector's going to be doing. Don't ask me.
So we're going to do some under eye for sure, and then we're going to do a little bit of high cheek, and then we'll come back in down here, do anterior jawline with a little bit of define to get a little bit of chiseling there.
And is the under eye going to be with PRF or the Easy Gel?
The Easy Gel.
I need the whole shebang here. I can't have. I need the gel. I need pop. But the funny thing, they'll play with me, and tomorrow I'll look. Am I going to be like feminized tomorrow with big cheeks and everything?
No, you'll be swollen for sure, but that anticipated little kind of blub underneath the eye and a little bit of swelling, but all that will get reabsorbed, and then your growth factors will start to build.
And the cup or 2 of vodka I normally take at night, is that a problem or?
You'll be fine, Doc.
I'll be fine.
You're
That's all I want to hear. I hate to tell you, it's pomegranate juice and soda water, but it sounds good. Like I live this life where I need vodka, but it's all antioxidants. But yes, any other questions on Easy Gel?
There are some questions coming in, but Louie, you're going to have to help me.
Takes 4 of them to run these cameras.
Is there any risk of an arterial injection?
You
or
gotta-
can you inject without fear?
So before I'm getting my injections here, you need to ask me about blindness and everything, Jamie. This is, there's a risk of that for sure. There's been find me wood. There's 0 documented cases of PRF or PRF gel alone injected causing that. We want to keep it that way, so we use large gauge cannulas. In terms of occlusion, it's theoretically possible. I don't think you're going to get an external occlusion. You can massage those away. Internal, we never want it in a vessel. It theoretically could happen. Again, the couple of cases that are demonstrated are PRP mixed with filler. If you look into the cases, and there's one from an illegal clinic, meaning a clinic that wasn't a certified clinic with physicians. So there's 3 cases that I know about, and those are around the world. So anything can happen, but the likelihood is small.
To heat and cool the plasma gel.
The cooling temperature is, we don't know the exact temperature. I know what it is, but the Easy Cool takes you to that temperature, but it's cool. The heating temperature is something you do need to know. And I am at 73 degrees. I look at it at 10 minutes and sometimes I add 2 minutes to it. So between 10 minutes and 12 minutes, but there's many factors at play here. One is that the syringe should fit snugly into the slot over here. If it doesn't fit snugly, then it won't heat properly. And Jamie, how far are you there now? What do you got done there? She's extracting the PRF?
I am, yes.
And then she will cap the PRF and put it back into the cooler. And we're timing here, I can see it. We're only at 3 minutes for that gel. We look at it at 10 minutes. I'm going to then she's going to cool the gel. I like to cool the gel. Some people don't like to cool it. I like to cool it for 1 to 2 minutes and then add it back. So before mixing.
And how often would you need to do this? Like I'm looking at your under eyes. Will it help with dark circles? How long do you?
It's a great question. So this procedure, I'd like to repeat it 6 to 8 weeks. But let's say you're on a maintenance schedule. Once a year is fine. Maybe once every 18 months. If you're starting from scratch and there's a bit of a hollow, think of 2 sessions, 6 weeks apart. Like everything, not everyone's going to need the second session, but I geared them up that they might need it. Now, dark circles are multifactorial. So, dark circles can be pigment on the skin. Dark circles can be poor lymphatic flow. Dark circles can be a shadow from a hollow of the bone in the fat pad because you have ligaments around the eye, the orbital retaining ligament and the tear trough ligament, and then the zygomatic cutaneous ligament. It's a very complex area and there's bone loss. So this, nicely enough, we can put on the bone and in the soft tissue. So it depends on what dark circles are, but you can also add ancillary services such as laser, fractionated RF, Viora VFR, different things.
Perfect. Someone did ask, how can you be any more handsome?
We're going to find out right now. And if they reverse me, it's a very good point you bring up, but no one who's handsome or good looking thinks that they are, for one. There's 10 things I want done. And 5 of them she can't even do. I want someone from upstairs to have to do it. But everyone has 5 things, 10 things about themselves that bothers them, that they don't like, that maybe other people don't recognize. Unfortunately, working here, these 5 girls point out every single day, every flaw I have in the brain, in the body, and in the face. So I get a big dose of it every day. They're actually very kind. They even got me pizza today. Thank you.
What size needle do you use to inject Easy Gel?
I think that's key, and Jamie, you can answer any of this. Do you want to answer some of this?
Sure. So for just PRF, I usually use a 25 gauge, 1.5 inch. But with the Easy Gel, I like to use a bigger cannula. So I'll be using a 22 gauge for that. It's just a little bit easier of a push because the gel is quite thick once we cool it down after the heating process.
And we got some cool 23 gauge needles. That was my gift to Jamie for the week. I came and told her I got a gift for her.
Maybe we should try those out.
You can.
Yeah, we got one.
Yeah.
Thank you.
But see, what kind of a day is this? But no, 20. So we have a lot of cool stuff coming down the pike. But yeah, we always use cannulas, no needles.
Yeah.
And do you do like a combination of PRF in some places and Easy Gel in other areas, or how do you do that?
Yeah, I think definitely you can play with the consistency of the product, meaning you can add more gel and a little less PRF depending on what you're trying to do. But in general, we tend to do full faces around here because that's what our patients want. And in general, we're doing more liquid above the brow and sometimes even underneath the brow, and then gel where we want more G prime. We're doing a lot of nasolabial folds, lips, vertical lip lines, of course jaw lines, chin. A lot of females particularly age more around the chin. And so we add a little more gel product. But yes, you can combine them to suit. And the real cool part of this is you just add a little more, you change your consistency by adding more or less PRF, and that will change your G prime. So you can stick with it very standard, or you can play with it. It's evolving.
A lot of liquid for skin therapies too. That's
good point. And hair.
How long will your downtime be when we do it under your eyes?
Jamie?
Anywhere from about 3 to 4 days. Most people like that residual swelling at day 3 because it looks quite full. And then all that swelling should be gone at like day 5.
I have a big event tonight. Am I going to be okay?
You'll be okay, but you'll be swollen.
Really?
Mm-hmm.
Okay.
Is
So
there any danger of migration or bloating by the Easy Gel?
bloating? Was it bloating?
Yep. You can read that.
Any, Jamie?
Oh, any-
A lot of people worry about filler migration, and so you can answer part, and I'll answer part.
Yeah, with the Easy Gel PRF, it's okay if it goes in at least a localized area. You're not going to have migration of any kind because it's your own stem cells, and it's just going to rejuvenate any area that it travels to, especially because when you put in either the liquid form or the gel form, it's going to go to the area of least resistance, so it's going to help build that area in general. With filler, yes, you're a little bit more conservative and aware with migration, but with the Easy Gel and PRF, it's okay if it spreads a little bit because it's all you.
I can't add one thing to that. That was perfect.
You taught me well, Doc.
No,
So
it's
we're
wonderful.
almost coming up on that 10-minute mark, just so you know.
So let's have a look at it.
Yeah.
And this is part of, I think a lot of people struggle with this part where we're changing things. It's not like, oh, at 10 minutes.
Totally. So we're at 850, just so everyone knows, and this is what it looks like. You can still see the little bit of liquidy in there.
Yeah, so throw it back in in
That's
probably
from
2 minutes.
Dr. Rajani's blood.
Correct. Yep. So this is just, we're warming it, but it's still not quite gel
Not
form
cooked
yet.
enough.
Mm-hmm.
And if you overcook, you kind of fry it a little bit, which hasn't been shown to be a problem, but I don't like that. 10 minutes is the sweet spot to look at it. That's going to probably be around 11 minutes,
Yeah.
probably for mine, and then we'll add it back.
So that.
Well, I think a lot of people worry about filler migration, but understand a lot of people, it's from different parts of the country, they see overfilling. Okay, so a lot of people want to blame it on this filler technique or that lip filler technique, and certainly this can migrate, but it doesn't draw water in like a hyaluronic acid filler. It doesn't give you an unnatural look. Even if I look unnatural for a week after this, it's all going to be better because it's my own growth factors and stem cells. So there's a little bit more leeway. Now, certainly you do 3 or 4 of these procedures, maybe you could start looking a little untoward, but we have a lot of leeway. And what people describe at about the first treatment at about 4 to 6 weeks is just glow, rejuvenation. I hate using the word lift because but you do get tightening in the skin and just somewhat of a lifted look, definitely after the second one, because you're getting the fat pads that are getting kind of healing, getting healthy, and you do get some volume, and by nature you get a bit of a lift.
Yes. So we're at 10:30 right now. So we'll.
Can you, 2 questions. One is, can you mix Easy Gel with Sculptra?
You can. I would direct. I don't. I mix the liquid with Sculptra. Part of the reason of liquid is why you want it is because it spreads, and we want Sculptra to spread. So the gel, we've never had a reason to mix it with Sculptra. One of the things I see out there that worries me a lot, everyone wants to make up this concoction of that, or microneedle Sculptra in and do all these things. Some of it makes no sense. If you have the money to microneedle Sculptra in your face and 3/4 of it go on the floor, you're doing pretty well for yourself, great. But for most of us, I want my Sculptra on my bone. I want my Sculptra in my fat because it's expensive. And most people they make these things up and then they do them for a month or 2 and they're gone. There's no need to make stuff up. And so in general, yes, mixing PRF and Sculptra is amazing because you're getting dual power and they're both liquids. But the gel, it's a thought, but you could also have an increased risk of nodules because nodules come from clumping. Whereas with the liquid, you're not going to get clumping. So you have to be careful, in my opinion.
And Doc, just so you know, on the time here,
Yeah, let's pull it out. That should be perfect. I can tell you already. Looks perfect.
just so everyone at home can see.
And how would one improve their blood before one of these types of treatments?
Well, you do the opposite of what Dr. Rajani does. No pizza, no coffee, and you might drink a glass of water now and again. So we're going to cool that gel, put that in the cooler for a minute or so. But great question, because I have a whole supplement line coming, and one of the supplements in there is going to be for optimizing your blood before these treatments. Obviously, that's not a huge seller. Everyone loves that. That's going to lose me money. But at the end of the day, I like it because I think it's important, and certainly we'll make it available to clinics. But that's a very small segment of the population. People are getting PRF and PRP, but I think it is important. So there's things that you can do, glutathione, turmeric more long-term, things like krill oil, a double-edged sword because it can thin the blood a little bit so you can get bruising on the other end. And water, I think, is good. and anything to help with the growth factors and stem cells. One would say exercising an hour before would be great, right? Because anything to get your endorphins, mobilize stem cells, all those things help. But we do have a supplement coming out for it. But in general, most importantly, is drawing it up correctly and spinning it correctly. 90% of people struggle on that step. And partly because they're trying to rig it up. They're trying to get their own spinner. They want to get a tube from here or there, and they want to make it up. And then they're clotting, and then it's unmeasured. Understand the spinner angle, the speed, everything's highly measured, and the growth factor stem cells are measured. Once you change the angle, the speed, the distance from the center of the centrifuge, even the tube from 10 ml, 13, it changes the whole milieu.
Quick question. I know we're doing a lot of Easy Gel and PRF, but one person asked about Sculptra for older skin.
Great. There's no age for Sculptra, and I have patients, my oldest patients were 93, 96. They did great with it. A lot of people wonder, well, if they don't have growth factors and stem cells, that's good, we can mix it. Growth factors and stem cells, no, they respond well. But the caveat being that sometimes older people have more loose skin, more bone loss. Do they need surgery? Do they need a facelift? But I've always found good response and reasonable response. And sometimes it fools you the other way where they actually respond very well. So I treat all ages over the age of 21, of course. But on the upper end, no big deal.
So, real quick question, can you get any nodules from this
No.
treatment?
Ready to inject me?
Yes.
So we're going to put it into the 1 cc syringes. And watch this. I think this is cool to see for those watching. If you want to come over, the 1 cc's are great.
So these are the red 1 cc's. So just let me know that this is the heated gel here.
Okay.
So we're going to put a little bit in there. And I have the PRF here ready in case we want to change that consistency, make it a little bit more liquidy. Just going to prime this.
I'm zooming in here.
Okay. And I'll come to you guys too. Just going to lure lock this. And then I just fill each syringe up.
This determines how good I'm going to look because the more syringes, the better, Jamie.
Yes, and I think we're going to get quite a bit. So these red ones are 1 cc. And this white one here with the albumin is 3. So we should get about 3 of these red guys here. And everything comes in the kit. So it's really nice to keep you kind of coordinated and on track with what you're doing.
And someone asked, do you prefer this over Sculptra, or is it a combination, or what do you?
It's a tool in your practice. Like I had someone in today, and they had threads. They had Sculptra in another country, and they came in and they really liked the idea of having something all natural added to that regimen that she'd already had. So I like to use it all, to be honest. I never put Sculptra under the eyes or in the lips. Go ahead, Jamie, there. I never put it under the eyes or in the lips, so this is a great tool for those areas. In general, most people are going to get a few vials of Sculptra, a couple sessions of this, and then maintenance once a year, and to start up twice a year. So most people coming into clinics now, the one thing that's obvious is people spend, there we go, we got 3.
Oh, wow.
Great.
And where do you get these kits, by the way?
We get them at cosmofrance.net.
Okay.
So Cosmo Brands makes the kits, and everything comes complete.
Do you, another question on Sculptra. Does Sculptra metabolize faster in people who exercise daily?
No. The Sculptra molecule is PLLA, of course, polyl-lactic acid, and metabolized into carbon dioxide, water, lactic acid. It's gone from the body. It stays in the body 6 months to 23 months is the longest time, 23 months that it's been found, and it's gone. But people who exercise tend to lose more fat. They lose more bone potentially, especially given their age. So they have that feeling. But we've never seen that
I have
occur.
a question actually myself. Are you going to talk while she injects?
Yeah, of course.
Can we do that?
Yeah,
Or
you're
she
ready?
can talk right now. Yeah, what are you going to do first?
So we're going to do your under
Okay.
eyes first, and then
Okay.
we'll come in and do that lateral height shake
Okay.
here.
Through
We
anything.
have so many people
True.
popping in here. So if we have a poor connection, we apologize, but I'm going to continue live as Dr. Rajani gets injected by our senior nurse Jamie here. And where are we going to start?
Just underneath the eye here. So I'm going to give you a little pinch, doc, and we just
Okay.
cleanse the skin. We're using a 23 gauge. 1, 2, 3, big pinch here.
23 gauge. Now, I did no numbing. I tell people, and when
Lydia's going to hold his hands in 2 seconds.
And when we train, like people are like, use no numbing. You don't give people numbing. You're cruel. But I prefer less. like for my patients. So I'm not going to sit here and use numbing, and then tell them not to.
So a little pressure here.
Okay. So it's not that numbing's bad, but numbing cream does things to the skin. This is deeper. Okay, so how much does a numbing cream help at this depth? I don't know.
I'm gonna start filling here a little.
Okay, so she's feeling, it feels a little cool, which is nice because it was in the cooler. And so yeah, when you use a micro cannula, you're making that little tiny opening, and I don't know that the numbing cream does anything except mentally.
I'm just gonna come down here on your lower orbital rim.
Okay.
Spongy right there.
We love the orbital rim.
Maybe at this time, if I want to.
Now, can the patient request something?
Can they
You
request
want your
something?
lips done?
Oh my goodness.
Um,
Good.
No, I'm just, the lips are fine. We'll have to take a vote on that Instagram. The people think I need lip filler. My God, I was born with big lips, I thought.
We put one on this side, Doc, for you. And then we'll do one on the other. And then just like half a cc on each.
So, you know what I noticed?
And
I
remind people, some people are just jumping in.
This is
What are you having injected and what are you doing?
This is Easy Gel from a blood draw that I suffered through. And then we heated up portion of the blood, and then we added the portion back. And they're doing my under eyes. And I have a question, Jamie,
Yes.
before you poke me.
Yes.
I noticed my lateral orbital rim was hollow. Can you get that lateral orbital rim too?
Like right up here?
Yeah,
Oh yeah. Do you want a little bit right there?
I do.
Let's do it.
Because everyone, I mean, not everyone, but in general, a lot of times that gets missed.
So we'll do 2 injections.
You can
on
do
this
2
side.
injections.
Yep. So we'll do one here.
Yeah.
And then one right through
When
here.
when you do my high cheek or something, you can do
we
it.
can do that also.
See how high maintenance? I'm in the middle of getting injected, and I'm
wasn't
telling
gonna
her,
say anything,
I'm
but-
telling her what to do, and
Okay, little poke here. We'll do your
Okay.
under eye first.
Okay.
So 1, 2, 3, and little
Can you
pinch.
use this on the 11s?
you can. You know, those vessels, the supratrochlear and supraocular vessels, coalesce up there, and they communicate to the retinal artery, and that is the problem, right? So things can be done. Theoretically, that could be a problem.
Twinge right
Use a cannula, but I would hesitate to say that people should feel like they're safer than they are with fillers, although I believe they are safer with this. However, I would not use it. I'd rather use threads in the 11s personally. Jamie, what do you think?
I would definitely prefer 11 or the threads in the 11.
Yeah.
So it's just
I mean, we're in the
easier.
United States, and so you got to understand you're in the #1 lawsuit country in the whole world. So do you want to take that risk? It's up to you. Anything can be done.
I'm
The
gonna
question
come
is,
up here,
should it?
Doc. I can get through
Yeah.
there, just through this
And
opening.
how does
Yeah,
this
yeah.
feel? Like you're getting injected under the eyes? Is it?
It feels great. You know why? Because I'm looking at the end result. I got to be on a YouTube video this weekend, and everyone's going to look at me and be like, Rajani, you look like you're 100 years old.
Oh my goodness.
So I have to, I'm excited about the results. That's how I feel. Honestly, there's no pain. There's a little kind of a weird twinge, a little pressure here and there. Jamie's amazing though, whatever. But it doesn't, I mean, it's a micro cannula. The only opening was through a little needle.
Okay.
So it feels great.
I'm going to shift you towards your left, Doc. We'll do this side cheek, and we'll kind of finish this little orbital.
I'm just happy I know what the left side is. So we're going to do, where are we going now for people? So they
Yeah,
know?
so we're going to do a little bit of high cheek, but also kind of come right here at that lateral orbital rim that
Can we
were
have them
chatting
sit
about.
up and look at what the
Sure.
under eye looks like
Yeah.
now that we're injected? All right.
Are you feeling okay, Doc?
Oh, I feel great. I feel great. You feel like a tiny bit of pressure, but I mean, you feel like a snatch pressure or something. I'm sure it looks weird, but.
So what we did is we put the Easy Gel underneath the eye.
Yeah.
And you can do 2 layers. So people ask me all the time, if you're doing liquid, you can go one superficial and you can get the lid, the palpebra here, and then one on the bone. Remember, dentistry is used on the bone in the teeth, in orthopedics in the bone. So you can do a 2-layered technique if you really have a deep tear drop. But with this gel, you don't have to necessarily do 2 layers because you're in there.
You don't really look too swollen.
That's because I needed the filler. That's why it was so hollow. Some people do look better after. I don't find you get a lot of downtime from the gel. The liquid, sometimes you get a baggy under eye, but I don't find most people get a lot of downtime. They like the look of the gel. You don't overfill per se. You can overfill and then massage it, but A lot of people ask during the trainings when we do the hands-on, do I overfill places because they think it's going to not last? No, just slightly overfill.
Yeah.
And after you inject, and this is a question for both.
I'm going back to
Dr.
my treatment
Yu
here.
And Nurse Jamie, like, would you massage that product more into the eye or just leave it as it is?
I usually leave it as is because after it settles, it's always going to go to the area of least resistance, so it spreads a little bit. So I wouldn't massage, I just leave it where it is because I put it on the bone a little bit deeper and I want it to kind of sit there.
Okay, and can Dr. Rajani play hockey tonight or is he restricted with his activity?
I got a game Wednesday, and I just play anyway, no matter what people do to me.
No, I would say he could if he wanted to.
And what would happen? Just increased swelling, maybe some bruising?
Mm-hmm. Yep, that's always a risk when you get your heart rate and blood pressure up. I'm going to give you a little pinch right here, Doc. Okay?
Okay.
1, 2, 3, and pinch here.
And what are you doing now?
So we're doing the lateral high cheek, and I put this little cloth here just to maintain sterility, just in case. And we're gonna get this lateral orbital rim, and then we'll come back and we have another full syringe, and we'll come back and do this high cheek area.
Oh, that'll look great.
Yeah. So coming in here, Doc, a little bit crunchy
Okay.
sometimes.
Okay. Feels like you're in my temple. It's so weird because you can't tell where it is, right?
Mm-hmm. Yeah, we're just on that high cheekbone
Yeah,
area.
it's great.
A little bit of a push. Good job.
So you feel that push, and I think that can make people feel like woozy right there, because it's like a push in your tissue. And in fact, I think that it's felt like the orbital retaining ligament, and maybe you felt that when you went through.
I did, yes.
Yep. And so those are ligaments in the face, and I think sometimes with the lip filler with cannulas, people get a little woozy because if you don't know what's going on, it does feel weird.
You can hear it
and you can
sometimes,
hear it.
too.
I think a lot of this is having trust in your injector too, right? So it's like your dentist. If you go and you know, like, they know what they're doing, you're like, okay. So make sure you go to someone that does like hundreds of these things, not like 2.
Yes.
And the Easy Gel, someone asked, is plasma, correct?
It's yes, platelet-rich fibrin. So the blood is made of many components: platelets, red cells, white cells, and think of plasma. Those are main components. And we want the portion of the platelets because that's where the growth factors and stem cells hang out. So we spin it very particular with the right spinner, the right speed, the right tube to get the growth factors and stem cells. So plasma actually doesn't do too much unless you heat it.
Yeah, I'm going to turn you to your right, Doc. So I definitely do it on the bone as well, just because I feel like it gives enough pop, and that growth factor only also thickens that bone right here. So I like to go fairly deep with the Easy Gel PRF.
Okay, and then that'll different when you're trying to contour the chin and jawline as well?
Say that one more time, sorry.
Just what depth will you find most effective when you're contouring the
The
chin?
jawline?
Yeah.
Yeah, same. I always like to stick on the bone. If I'm using like a gel, I'll stay a little bit more superficial just because we'll get that really big pop. But when we use the Easy Gel PRF, it's a little bit more subtle of a pop, but I definitely like to use a product like Define or Radius, something like that with a bigger umph. And we'll be doing that actually in Dr. Rajani's anterior jawline.
Oh God,
All done, doctor.
that's it?
Yeah, that's it.
My
Oh, let's look at your
God.
high
Okay.
cheek.
Okay. And the funny part about that is I didn't feel like you were in the high cheek or whatever. It
Turn
was just,
sideways. Oh, nice. You can see that. Do you want to point that out?
Yeah, so you can kind of
Wow.
see there's a little bit. Here are the 2 injection points where we just held pressure to try to prevent bruising. It just helps with that as well. But you can see there's a little bit of fill here, and then if you turn towards me, you can see it on this side as well. So it fills under the eye and then in the cheek.
so if I had to go home and make a YouTube video, would I be able to do that now? Do I look okay to do that? Because that's what I love the most. That's what I do all my evenings. I know you guys want to go to the clubs. I like to go make YouTube videos.
And another question is, couple, do you need to massage? And
I may as well get the Define.
why
I'll go
would
grab it.
you use?
She's gonna grab the Define and she's gonna do a little chin. If you guys want to see that, you can hang in for
Okay,
there.
great.
Um,
But why would you do this Easy Gel for a high cheek versus filler?
Many reasons. Number one, for me, I don't want crow's feet there, and I never use toxin. I use very little toxin, so I have full movement. This is the one area I use toxin, but I never treat crow's feet. Most guys don't necessarily want a brow lift. I like all the movement here, and so it helps fine lines and wrinkles. She had it in her hand. It was my stuff. She had it there anyway. I'm like, oh, add a little in the cheek. probably it's been 4 years since I've had anything up there, and it was Sculptra. This will accentuate all of that, and I won't need my Sculptra up here, and it's all natural, so why not? I think it's a good point though, because where would I go on a female if I have leftover? It's almost always lower face, because
Really?
this is the skin in the female. How many people we have in here today where we're tightening lower faces, and that's the struggle for the female. And even I see loose skin here at times. I can just dab some Sculptra in there, but how nice is it to do something all natural with no Sculptra that tightens the skin, and you can add a little bit of Sculptra if you want. So it's a good point, but yeah, cheeks look good. And your friend, we did her cheeks on it, and she looked great with it. And I think we have before and afters too of her. And I have before and afters on her we can show you, but she loves her cheeks. I don't think she's had anything else in her cheeks since. And that was 8 months ago or something like that. So cheeks are actually pretty good. There's a general move, happy not to have fillers.
Oh, looks like you got the white pencil.
Oh,
Yes.
What are you and Olivia up to?
Okay.
So we're gonna do Dr. Johnny's anterior jawline. He has really good chin projection. We always look from the side and the front, make sure his proportions are adequate. But Doc, I'm actually gonna have you sit straight up.
Okay.
And I always have patients sit up before we draw, just because it's a little bit easier to see them as they would be in natural life versus laying down. So what I'm just doing is kind of drawing out where I think Doc needs a little bit of volume. So I'm looking right here at this oral commissure area, and I'm just going to make a little mark where I see that.
It's called a jowl, by the way. They want to be kind, but it's okay.
So we'll make a little mark right here, and then right there to the chin line, and we're just going to help chisel that area out. And do the same thing on this side, and everyone is pretty asymmetrical, and actually Doctor's deficit volume starts right here and right about there. So this side has a little bit longer versus this side, which is a little bit shorter.
And we probably should use that new 23 gauge cannula here, because Define, right?
Yep.
It's perfect for that,
Yeah.
because Define's a harder push.
It is. So that's what I do have here is the 23 gauge 2-inch cannula.
It's my little way of telling her, make sure we use the 23.
And are
Yeah.
you doing the chin too, or are you just doing the jawline?
Just the jawline right now. We can always reassess after we do it. The goal is not to make Doctor wider, but more chiseled. So we're not going to bring width to it, but a little bit on the underside, just so it kind of sharpens him here. He has good chin projection.
That's
so
because you put 2 vials in there
I did
a year
yes,
ago.
That's right. it's
And that
also-
lasts a long time. Like everyone asks, how long's filler last? But that was a year ago, and it was like you did one Define and then another Define like 2 months later or
I
something
think
like that,
so,
right?
Yeah. You were sore after that for a little bit.
You
weren't
get a little
Yeah.
sore for like a few days. I think that's pretty normal in the
Yeah.
chin. Like it just doesn't bother you, but if I didn't know,
Yeah,
you
a
know,
little bit of a surprise.
yeah. But it's fine because you're right on the bone. We put it right on the bone that time. You can be ejected in the soft tissue in the bone. We put it on the bone.
Yeah.
Okay,
So
so-
we're gonna start with his right side first because there's a little bit more room we gotta work
Okay.
with here.
And if we need like more filler, don't worry. I brought my checkbook. So like, this is my career. I'll charge it to my YouTube corporation. You know,
There you
I'll
go.
write this off. Don't worry.
And can you bite down for me, Doc? Good. Okay. And so what I'm looking for here is that masseter muscle, and we can feel on the bone where his artery is. So you want to be mindful for occlusions and just safety that we're always checking for that. So you can feel his artery right here, kind of where I drew that line. So we'll go right either in front or right behind it, probably with that 2-inch, so we can get that full length of the jawline. Oh, sorry, Liv. Yeah, thank you.
Here comes
Yeah.
Olivia to hold your hand.
Oh, good,
Holding
good,
his own
good, good.
hands, man.
Yes.
So we're gonna go behind that mark, just so we can get that full length here. So a little poke coming, 1, 2, and 3. Good. And
I mean,
don't
you just don't feel it. I can't imagine people numbing for injections.
we numb for quite a while sometimes.
I know.
Haley coughing over there. So Doc has really good skin, and I'll usually pinch it to see if we can see that little incision mark pop up here, and I do see it.
I'm on my krill oil, so I should be bleeding.
No, you're good. A little push, kind of crunchy sometimes, and it's good to let your patients know that when you get to that depth. Sometimes you're working through other products that have been placed there, like Sculptra or Bellafill, which can be quite tough to push through at times. Like right here, see that little push right there?
I felt it. It was Sculptra for sure. That was a Sculptra pop.
It was a little crunchy there. So we're just going to start filling. And they may hear it too when it goes in.
I mean, it's less than 1 out of 10 in the pain scale.
Yeah. Little push again, little sculpture I'm kind of coming against. And you can always inject a little bit, make a little bit of space in the tissue, and then advance it.
It's a hard thing to teach people to do sometimes, like to keep the finger on the trigger
Yeah.
and integrate and inject, but it's important.